Mr. Charles has said, please don't hesitate to write it up. So yes, so hopefully we'll be looking at preventive measures and early interventions in psychosis. Thank you. Yes, well, I guess, do I go on? Charles, do you want me to go on?
Yes.
Okay.
So I think we have a couple of us who are lay.
Do I go on? Okay.
Yeah, so if you can, explain some of the jargons for us, that would be useful.
All right, yes. my apologies. So really, early preventive measures in the mental health services, I'm just kind of talking about the general measures that we can all take to reduce our tendency of having mental health issues, or we'll be looking at, I think I'll be giving the commonest examples or what research has found to influence mental health issues, so that we kind of are mindful of it or look out for it and see how we can make those changes to influence our mental health or keep our mental health going. So if I start, I think I am not, you just need to specify, I am a general adult psychiatrist. I'm not a child psychiatrist. But then when you are talking about preventive measures in mental health, you are mainly looking at the influences as a child, the influences as a teenager, and the influences as an adult. And these are ultimately that influences the older adults or the general adults in their mental health. So to start it, I think one of the commonest issues that keep on coming up, or research have shown, is that parental mental health issues do have an influence on the impacts of the upbringing of children and how they also associate with society in general. So as some people would put at nature, in terms of the environment, does have quite a lot of impact on people's mental health services, specifically if people have identified or diagnosed mental health issues. It's felt that it could, if not managed appropriately or with a good support, it could have an impact on their upbringing of their children or their children's mental health in the future. I think the commonest examples of mental health issues that come up as a result of parental, we're not talking about genetics, just talking about the environment, is anxieties. There is a lot of anxieties that kind of people develop as they grow older as a result of their influences from their parental mental health issues. Depression is also a common example. And I think the main issues, the main thinking is that when parents have their own mental health issues, they are not able to look after their children properly, or the level of parental care is limited. And I think potentially that's where, as a society, we could come in if we are aware of our neighbors or relatives or close friends who have mental health issues, see how we can influence or support them in the upbringing of their children. One also very common but very important factor is abuse. When we talk about abuse, we have about 5 types of abuse, and we have the commonest ones that I think, which is well known, and because of its severity, is well spoken about, is sexual abuse. We'll come back to that in a minute. But then we also have physical abuse that, rightly or wrongly, the Black Afro-Caribbean community we have a tendency, or we get accused of it quite a bit, but then it is well researched that it does have an influence on our mental health issues. There is the issue of emotional and psychological abuse. Once again, that is not necessarily limited to Black Afro-Caribbean communities, but it's also one of the felt to be a common issue in our communities. So coming back to sexual abuse, it is quite, as we think we all accept, is quite a significant issue. And it's the interesting thing about it is that in as much unpleasant as it sounds, most sexual abuse, the perpetrators are within families. I think the research suggests that 85%, if not more, of perpetrators of sexual abuse are within the families of the victims. So yes, teaching your children to be mindful of strangers is a good thing, but also you need to keep the awareness that these tend to happen with close relatives, close family members, and we have to be mindful of that. The physical abuse is a debatable issue, but I think, and we have all our individual perspectives on it. For me, I think the issues is with the severity of the physical abuse that is meted out. I can't remember verbatim, but I think it's against the law to hate any children. But that does not mean you do not discipline them. So I think that is where sometimes the contention is. Not hating them does not equate to not discipline them. And I think it's felt that within the Black Afro-Caribbean community, there's quite an issue. And there are a few other pointers, but I think I'll just take a breath here, just in case people want to ask something specific, then we'll go on. Thank you.
So, any questions before we continue? Okay, Mommy, I think we can continue.
Okay, thank you. So, so the abuse is kind of one issue in terms of things that we could prevent or try and focus on as a preventive measure. One particular kind of abuse that tends to happen with adults is domestic abuse. That is a whole kind of topic on its own. But then just to point it out that domestic abuse does have a significant impact on the children around who are exposed to these abuse. Research suggests that some children end up being perpetrators of domestic abuse themselves, but also it does have an impact on individuals' mental health in terms of anxiety, depression, in terms of self-esteem, in terms of their self-confidence. So it's something that as a parent, if you can deal with it or try and minimize the exposure children have to it, then it will be a good thing. If it's always with the religious and spiritual reasons why people tend to stick with situations or try to make it work. But in as much as you're thinking in that aspect as well, I guess sometimes you just kind of have to accept that situation is not working and you have to look out for your children or those around you who are being influenced by the abuse they are witnessing. And most of the time, I think most parents or most of those who are exposed to abuse, and it's not limited to just male abusing females when we talk about domestic abuse. I think there is research to show that there is quite silent abuse of female abusing males going on, but because of stigma, it's not spoken about. So it goes either way. And most victims try to work it out, try to do as much as they can. And due to self-esteem issues and a few other issues, they tend to stick with the situation, but it felt that it does have an impact on mental health issues. So I guess the advice is if you have to leave or it's not working out, you have to leave. Having said that, divorce is also known to have an impact on mental health of children as they grow up or as we end up being adults. I think most of my patients that I do assessment with, there is always, with quite a high percentage of them, there is always issues of domestic, there is always the issue when you look back of divorce, their parents having divorced when they were at a young age, and there is a lot of issues that come up in terms of anxiety. You have teenagers who end up deliberate self-harming as a limited way of expressing their emotions. So divorce does have an impact on mental health issues. Having said that, once again, if there are reasons why you can't stay in a marriage, then you have to weigh your options or the impact, which one is having a more significant impact on the child. Those would be the main, well, there is the issue of substance abuse as well, which is once again quite a broad issue. And when we talk about substance abuse, alcohol is an issue, but it is not really as significant or has a significant impact as substance abuse, such as cannabis use or other illicit substances. And I think there is a debate of cannabis going on, but generally the research that I have available to me suggests that wherever way you look at it, the long-term impact, it does have an impact on mental health issues. There are bits of the cannabis that are good, but unfortunately, separating them has been quite difficult and challenging, and therefore most of the time, the bits that influences or has a negative impact on our mental health is always present. Thank you.
Okay, Doc, I think we have a question for you from Brenda. Brenda, over to you.
Thank you. Good morning, everybody. Thank you again, guys, at CAHN for hosting this health hour. For those that have been on the last few calls where I've been available as well, will have my continuing frustration at the conversation within mental health, within our society, within our communities, and I'm referring to Black people specifically, seems to be being held by women. I'm looking at the screen now, and I can see maybe 2 or 3 guys, and the rest are women. And this conversation is something that I've been doing proactively for the last 4 or 5 years. Mostly it's women that turn up. The issues that are being raised are referring to abuse in families, divorce that involve men and women. What do we need to do to make sure that this is a balanced conversation, that we're not having an echo chamber of women expressing, moving on, and leaving the men behind, particularly when men have a higher risk of suicide and higher risk of psychosis in cases where things that are treatable and can be dealt with going too far. I want to understand or hear your thoughts, Doctor, on what we need to be doing, because at the moment I'm feeling really frustrated that these conversations and this journey is being carried by women along, and we're leaving the men behind.
Yes, thank you very much for that question. It is a difficult one, and as you've clearly pointed out, that yes, I think that to a degree, I'm not sure why, and I haven't really come across a research that explains why, it is always difficult involving men in discussions about mental health issues. They would rather kind of, if they are not professionally involved, it's something that men in general, I think it's actually generalized to all races, find it difficult discussing mental health issues. There is some suggestion to imply that there is a sense of weakness when you accept that there are mental health issues, when men are involved in mental health issues, or men are involved in discussing mental health issues. So truly, it is an issue that has been going on, and I think there are a few charities that are coming up and trying to educate men about it and reduce the stigma, because as you rightly said, mental health issues, and most of the time the very serious ones, are quite evident in young male adults. And also, and I think that sometimes it's something like depression is actually one particular diagnosis that most men find difficult to accept. I think like the patients I've come across, most men are actually willing to accept having a serious mental illness like bipolar or schizophrenia, but find it difficult accepting or opening up to the fact that they are depressed. So it is an issue. And I think, I'm not sure how we deal with it, but I think the best that I can think we can do as women, and as you've evidenced that women are the most people on the platform this morning, is just discussing it as a family, discussing it with our young male children. And I think that is where we can have an influence, discussing it with our husbands, discussing it with our brothers. And I think that is a way of moving the discussion on. At present, I can't think of any other way, but I'm sure other people might have suggestions of what we could potentially do. Thank you.
Thanks, Doc. I'll bring in Professor Don Edge.
Sorry, I didn't hear what you said.
I'm bringing in Professor Don Edge. She wanted to make a contribution.
All right, thank you.
Can you hear me?
Yes, we can hear you now.
Okay, so a couple of things just to pick up on the previous question. So actually the research suggests that although Black men are often more spoken about in terms of particularly things like psychosis and schizophrenia, the evidence is that Black women are just as likely to be diagnosed. It's just not as well researched. So I think it's important to remember that being at the forefront also has an impact on our mental health as Black women. So we are carrying not our own stress and distress, but speaking personally, I'm worried for my son when he goes out the door. I'm worried for my brothers, for my, so there is a lot that we carry, and maybe that's one of the reasons why we're here, because we're not just here on our own behalf, but also for the other people that we carry. So that's just a statement that for me. But the other thing I wanted to raise, you've mentioned about the importance of the family, and I just wanted for you to say something about the tendency within psychiatric services to pathologize Black families, and for concepts like expressed emotion, and particularly high expressed emotion, to be used, in my view, to be weaponized against us in ways that I consider particularly unhelpful. And you may want to explain to the audience what some of those terms mean, but if you could address that, I'd be very grateful.
Yes, thank you very much for your contribution. And then the question, I think, just to explain, when we talk about high expressed emotions, is, as you said, it's kind of, it can be used in a negative way, but then generally my training and what we use it for is to express the challenges of, I think, it's used, if you're looking at it positively, it's trying to explain how how our expressions or statements about mental health or the stigma and how we approach it affects the individuals that we are dealing with. So you have if you're using, what is felt to be negative, that you have families who, anytime that a person opens up about something and they have had mental health issues before, then it's around them keeping quiet because of their mental health issues, or their views being kind of seen more than the patient. Yes, what you've said about the Black community being used as a weapon in a way, that view about high expressed emotions, it does exist. I'm not sure how you deal with it. And I think in a way, it's that partly due to racial differences, or partly due to, could potentially say partly due to ignorance or limited exposure of other races to how some Black communities express themselves, and therefore any way of people expressing some Black communities expressing themselves is felt to be in an aggressive way, and therefore is placed under high expressed emotions. And I think it's more of ignorance or limited exposure of some professionals to it. And I think it's also partly because when people are advocating, families are advocating on behalf of their relatives, it can be quite an emotive event, and sometimes it can spill out. So it's quite a delicate thing, not denying the fact that yes, sometimes it can be used, or families feel that it's being used against them. But I'm not really sure of how we work around it. Or I wouldn't say families should not express themselves, but I guess sometimes if you are aware that the way you are expressing your emotions, or you are going to get angry or upset in a particular situation, then maybe kind of finding another way of expressing yourself. I'm not sure about. I don't know the answer to that. But yeah, but that does exist. I think sometimes too, part of the reason why families in general can get frustrated is within the confines of a mental health practice, the patient is priority, and the patient's views are priority and taken, and I think it is acceptable that the patients should be priority, views are priority and taken into consideration. And sometimes there is a contention with families about what the patient is expressing and what the professional is seeing in front of them, and the family having a different view about it. And in my experience or cases I've come across, sometimes that is a contention. And there is what we call a mental capacity act, which generally refers to the person's ability to make decisions on their own. And sometimes that is where the contention comes from, that if families have a different view about the patient's presentation, and the patient is given a different view or making a different request, and the professional is able to justify or thinks that this individual has capacity, then unfortunately the family's concern or the family's view is deprioritized, and that can be quite a difficult situation for most families to deal with. I'm not sure if I've addressed the question, but that is my general view.
Thanks, Doc. I'll bring in Dr. Diana Asante.
Hello, good morning, and thanks for having me again. On the same issue, Charles, is that what you want me to?
Well, yeah, you can comment on it, and then you can tell us what you're seeing on the front line as a GP, and some of the stuff you've had to refer. Then we'll take more questions.
Right. Yeah, so on the same issue, I agree with what both contributors have said, both what Mami said and what Prof said, that it is an issue, but obviously there are positive and negative outcomes from it. And what we need to remember is, a patient is a patient, but a patient's presentation or how they express themselves or not express themselves is a very complex mechanism, which is sort of contributed to by their culture, their race, their interactions with the people around them, their level of knowledge or not being knowledgeable enough in a particular area, their personal experiences, etc. So all those things will come into play and will affect how people express themselves and even how emotions come out in certain circumstances. So I absolutely agree with Mami that it could pan out positively or negatively. Maybe how do we address it? I think from a healthcare professional point of view, we need to recognize the fact that every individual is different, and where they're coming from, the family, the race, the culture that has brought them up, all feeds into how they might express or not express themselves. And also things like these fora like these, talking about it also helps. But equally, from the patient's point of view, we also need to know that there's a challenge on the healthcare system. So when you go in and you see your GP or you see the mental health professional, they are under time constraints, so they're sticking to the patient. But maybe we need to use our GPs a bit more. And what we tend to do as GPs is before we refer patients, we try and gather as much information as possible. So that is probably one way where prior to the referral, if there's any information that the family has to provide, any input from, if it's a child, for instance, school, you know, close relations, that sort of feedback is quite important to framing the bigger picture, so that although the patient is the priority, we know that there's this wider circle around the patient that can influence the patient's behavior, but also that can help in the patient's management and the patient's recovery. And having as much information as possible, what you are observing, which when the patient finally goes to see the consultant might not have that opportunity to hear what the family is saying or see what the patient is doing at home. Having all that information and sending it through will be quite useful. So we shouldn't be afraid to bring these things up, but we should just be aware that there are some unconscious biases in the background. And certainly, you know, we just need to try and promote the positive side of it and try and reduce the negative impact of it. Thank you.
So I think, you know, a couple of, you know, comments in the chat box about, you know, lack of cultural competency training, unconscious bias, structural racism. So there's a question, and then we, you know, in light of all that is going on, Black Lives Matter, you know, for both you, Diana, and, you know, Dr. Safo, can you give us, you know, some thoughts and reflections on that and what you see on the front line? And also with your medical training, you know, would you agree with some of the suggestions that, you know, we need to have a lot more cultural competency training?
I'll let Mommy go first.
Hello. Yes. So I think once again, I am not going to comment on any of the issues of Black Lives Matters because it's quite an emotive topic, and I don't think there is room in 1 hour to have any decent discussions about it or containing emotions about it. So I'm just going to end. That is not my specialty, my field. So I'm just going to stick with what I know. So I mean,
what about your training? You know, what about the training? So
yes, so that's it. So in terms of, I mean, I know that equality and diversity is part of, I didn't train in this country. My primary medical training was not in England, but my specialty training was in England. And I'm aware I do have medical students on rotation with me. So I'm aware that at present, medical students are trained in terms of equality and diversity issues. As to whether, I'm not aware of the content of it, and as to whether that is enough, I cannot say. And I'm also aware that increasingly, equality and diversity is actually one of the mandatory trainings in NHS services. Once again, the content is kind of limited, or what the specific issues are limited. And I think it's all, in a way, it just boils down to people having some degree of awareness. And I think the training that is available, the least that it does is making people aware that there are different views and different perspectives, and there are different racial issues going on, and people kind of opened to that possibility. I do not think that it necessarily equips people to deal with issues. And I think from time to time, in as much as all the best will in the world, there would be issues of race and inequality, and how other professional, in terms of your interactions or exposures to professionals. But I think so long as you bring it up as to how you're feeling, or as to how you're feeling that you're being discriminated against, I think it's a learning process that we all have to accept that the other races, whatever race, Asian race, white race, I might not necessarily be exposed to what some of our behaviors or how we express of ourselves. And hopefully, I would like to think most of them are willing to be educated, and as we go along, and maybe that would be the attitude that I take, that there is a possibility that they would be saying things or making statements that are not appropriate. And if we have the opportunity in a calm way, in a way that is people are to educate people as we go along. With all the education, all the mandatory education, sometimes you have circumstances where the person is challenging, and these individuals would have to deal with it as they go along. So I don't think there is a collective answer. I don't think there is the particular education or the equality and cultural diversity training that we are all having is enough. I think it's something that we all learn along the way and have to deal with along the way.
Okay, over to you, Diana.
Just to add briefly, I mean, obviously, equality, we are talking of everyone having equal opportunities, regardless of their abilities, their background, etc. Diversity, we're talking about the fact that we need to appreciate that different people with different values, different morals, etc. So directly to your question, is there enough on equality and diversity? Personally, I don't think there is enough. Is there an effort being made? I think, yes, there is an effort being made. There are modules all over on equality and diversity. Each time you apply for a job, the minimum sort of basic training that everyone has to sort of do on their e-learning will definitely have equality and diversity over there. And medical school-wise, I trained abroad as well. So in our sort of setting, probably there wasn't that. It might come across it sounds slightly, different saying it this way, but probably there wasn't that need at the time to be talking about equality and diversity because it wasn't an issue. But we also didn't grow up in a setting where we saw people differently anyway, and we didn't grow up in a setting where there was any need to discriminate against anybody. But I think it's irrelevant of that, because we need to be aware of equality and diversity, and we need to be consciously making sure that we are providing services to everybody in an equitable way. And we need to be consciously making the effort that we are recognizing diversity. And I think that's where the problem comes in, when people either unconsciously ignore the fact, then they end up probably doing things that become detrimental to the person who's on the receiving end. So from a healthcare point of view, modules are available, learning modules are there, but whether on the ground it is fully translating into what we want to see, that is debatable. It's a journey, because clearly not everyone has the same degree of exposure to a very diverse group. So I'll give you an example. A long time ago, in one of the practices where I worked in Wiltshire, I had a lady in her 90s, a Caucasian patient in her 90s, lovely lady, who came round to have a review. And for instance, the doctor that she wanted to see wasn't available, and so the receptionist said, "Oh, we've got Dr. Asante available, and she's great, and she'll see you." And because she had never, in that area where we lived, there were a handful of Blacks, and she had never come across a Black doctor. She'd never come across a Black person. So she said, "No, I don't want to be seen by that doctor. I don't want to be seen by that doctor. I want to see this other doctor." And the receptionist had to explain to her that this is not, it's not right. You should be able to, be welcoming to see whoever we are able to provide you. But equally, she has the right to say who she wants or doesn't want to see. So I could have translated that as, she's being discriminatory against me on the basis of my color or on the basis of my look or whatever. Or I could also interpret it as, bless her, she's never seen a Black doctor. This is the first time she's seen a Black doctor. But I think that consciousness needs to be there. So anyway, they dealt with it in an appropriate way, and the outcome was favorable. So there is information there, but it's not enough. We need to be doing enough. We need to be learning enough, and we need to be also educating our colleagues in a good way enough, because some non-Black colleagues are quite keen to know a lot more about us, and they're quite interested to know a lot more about us. And if we can sort of bring that information across in a positive way, then it would enhance people appreciating us better. But if we bring it across in a non-positive way, then that is where the outcomes are not great. Thank you.
So we've got a question in the chat box about how can we influence, or where are the conversations taking place about healthcare training, and how do we get clinicians or the medical professionals to get a bit more, not just having E&D as a tick box, but having some real cultural competency training and that awareness. So where are the conversations taking place for you, Diana, and then Dr. Safo?
Well, the conversations are taking place at every level. So at the level of colleagues who have already completed medical school, who are working in their specialities, the conversations are taking place there. And the conversations are taking place at national levels. The conversations are taking place at sort of college level. So every specialty has its college. So you have the Royal College of General Practitioners, Royal College of, the medics or the psychiatrists or whoever. The conversations are taking place at that level. In the practices, in the hospitals, in the areas where everybody works, the conversations are taking place there. And also for the trainers who train these trainees, the conversations are taking place there. So when I did my GP training, we did talk about equality and diversity, but as Mami said, it's a broad brush approach. No, they don't actually spend like a whole day's lesson on how do you treat a Black patient versus how do you treat a white patient, because nobody should be treated any different. It's a case of how do you treat a human being, but this whole thing has come up because we are segregating and we are saying, well, one human being looks different to the other. And so the conversations are at every single level. And even the people who influence the syllabus, the people who influence the training are aware of these things, and they are incorporating it into the training. So medical students are learning about this. People who are just qualified as doctors who are in specialty training are learning about this. And even as a consultant or as a GP or as a top level doctor, we still have these conversations on a daily basis incorporated into our patient management. I think what frustrates everyone is the fact that there's a lot of talking going on, but the action that we see might be little. But then again, it brings us to the point of, do we therefore say that because not much is achieved, do we stop talking? No, we need to keep talking, because yes, we need to see these conversations translated into actions, but unless we keep talking and we keep acting on them, so we actively make sure that we are aware of equality and diversity, but we're also translating it into the way we relate to patients and encouraging our colleagues to do the same, and highlighting in a positive manner when you recognize or you identify there is a breach in that area. You should be able to speak up, and that is what we should be doing, because otherwise, by sweeping things under the carpet, by not talking about these in a constructive way, the problem is not going to go away, and we'll still be at the stage of just talking and not being able to make change.
Thanks, Dr. Asante. Over to you, Dr. Safo.
Yes, I think Diane has said it all. Just to add a little to it, I mean, as Diane said, the training, I am aware the training is going on. And I think it has to be a continuing process. There isn't any way that with all the best syllabus in the world, you can address the issue of equality and diversity in one topic. I think some of the issues, in as much as in an unpleasant as it sounds, people would have to have exposure to it to be able to work it out, because you can give only so much examples until that situation happens, and then one has to realize that there are cultural issues here that they need to address, or the cultural issues that they need to be mindful of. And I think for me, in as much as we've agreed that these equality and diversity trainings are very limited. At the least, if individuals, all of us are aware that there are differences, there are diversity, then if you have that in the back of your mind, then whenever you approach an individual, then at least you are mindful of it. You are just kind of have an awareness of your own biases. If kind of can give an example, recently we had a patient from East African origin on the ward who was very unwell, and this person was accidentally picked up by the police on the ward. And when I'm talking about, well, she was was suffering with psychosis, and she was admitted on the ward. And then the husband, so she had left the house accidentally. And then when she was on the ward, the husband's view was that their cultural background, this was as a result of witchcraft, and wanted the wife to be discharged home. And we have what we call a mental health assessment. So this lady had been sectioned and on the unit, and the husband was not willing for the wife to stay on the unit because in his view, or their cultural background, this was purely due to witchcraft. And the consultant was saying rightly that this was psychosis. And eventually, because the husband was not agreeing to it, what was going to happen was that the lady would have to be discharged because the husband was not agreeing to her staying on the ward. And my colleague was suggesting, my consultant colleague was suggesting that the husband to be displaced as not taking the patient's view into consideration. And we had this as a case discussion because we have what we call academic programs. And I think my suggestion was that it needed to be a collaborative issue, that I didn't think it would be in the best interest of the patient for this husband to be displaced. Being displaced means the husband would have no influence of the patient's management again, and it will come under government. There will be the local authority taking it. But it was an issue of both sides having an awareness that there was some cultural differences. And in as much as, and that was what I was trying to explain, that in as much as my consultant felt he was unwell, she was unwell, that was agreed. And the patient's husband also felt that she was unwell, but it was the cause of what was causing her to be unwell. That's where they differed on. And I think that was kind of some of the issues that you can't teach, that comes across and that comes along, and you would have to recognize our biases and deal with it collectively. Fortunately, they were able to solve it, and both parties agreed that she needed treatment, and it was done. But these are some of the things that kind of, when I say it cannot be taught, you cannot teach it until you are in the situation. That's what I'm referring to.
Thanks, Mami. I'm going to bring in Esnat and then Simon Riley, and then, we will come back to you for some reflections. So Esnat.
Sorry, yes, can you hear me?
Yes, we can hear you.
Hi, sorry, carry on. Was it around the training that you wanted me to comment? Yes,
so some reflections, so you can say a few words, because you had quite a lot in the chat box.
Yeah, I think from my experience, I think the issues need to be brought up at the beginning of training. And I think that's one of the ways in which to normalize the conversation and to be able to discuss the issues around race, which I don't think necessarily happens. And to try and start to embed that kind of knowledge and training once you're out and you're working, I think is very difficult. From my own perspective, I trained here, even though I didn't grow up here, almost 20 years ago, about 20 years ago, I probably started my training, and it wasn't something that was really mentioned. I don't even know that we covered, and I'm not a doctor, I'm speaking from my perspective as a pharmacist, and I don't think it's something that we necessarily covered. So I work in education, and I work with undergraduates and postgraduates, and for me, I suppose, being one of the few Black members of staff, we all have sort of textbooks and scripts and all the rest of it. And it makes you realize that it's not something people consider, because I'll go through a case with students and they will say everything that the textbooks say. And then I'll turn it around and say, well, if I'm your patient with my color skin, how does this condition present? And it's not until those questions are actively asked, they're not maybe the most comfortable of issues to think about, but it's not something that anyone else asks them to consider. And it's just, I think about how that subject is approached, and also about making it comfortable to talk about those things, and making people realize that you're not pointing out something negative by acknowledging the color of somebody's skin. You're acknowledging it to recognize that there may be differences, and sometimes those differences are actually better for health and safety and the clinical decisions you make. But it's about getting people to normalize those conversations and understand that those conversations are an important part. I think cultural competence is something that's different, and it's not something that's addressed by equality and diversity training. And I think that from the perspective of somebody from a Black African heritage, I think maybe if more conversations were had, not just with patients, but if conversations were had with communities and with family members of patients, in a way that's more inclusive, and also if when guidelines are being designed, they've got greater representation of people from our communities, those issues would be heard and those issues would be recognized. So I guess it's about trying to make that happen.
Thank you, Esna. Simone Riley.
Good morning. Thank you for inviting me on this call. I'm coming from, as a service user's perspective here, having suffered with postnatal depression, and Dr. Dawn Edge mentioned something before which has resonated with me this week, is about people's mental health. It's a time where we can speak up and we can talk about Black Lives Matter and also talk about our feelings. And it's been quite a strain on me, because things that I've put to the back of my head throughout my life about racist comments, remarks, or incidents that I've been in have actually been brought to the forefront, because I've been thinking about it a lot more, which to me has had a strain on my mental health, because part of me is thinking, do I speak out about this? Do I keep it in? And it's stuff that I've kind of hidden away that has been brought back up again. So it has had a strain on me. But I also know, with regards to everything that's happening with the lockdown and people being isolated and not being able to see their friends and family, is again a time where people's mental health are at a challenging time. So the question that I wanted to ask is, how can we get the message out there that there is help and support available, and you're not going to be judged for using those services? Because that was one of the main concerns that I had when I went for counselling, and when I went to actually speak up to my doctor, is how am I going to be judged? How am I going to be perceived? Is anyone going to think different of me because I'm going to seek help? And I think it's something that we need to get out there to our community, that there is help available during these times. Thank you.
Okay.
Thanks, Simone. Any thoughts, Diana and Mami?
Thank you for your comment and the statement. As kind of you've said, it's very strange times. There is a lot of things happening. There's quite a lot of emotive issues going on that is rightly or wrongly affecting mental health and affecting lots of mental health issues. And I think, as you said, the issue of the impact of all some of these negative issues bringing up memories, I think with most individuals or with psychologists that I've worked with would suggest that you deal with it the best way you can. With some individuals, bringing back bad experiences or memories helps them think it through and helps them deal with it, and they come out on the other side better. With some individuals, it's not helpful to kind of treat bring back all these memories or retrieve them and go through them. So I think it's more of, on an individual level, how you have found it helpful in the past. With an individual, it's best to block it. With some individuals, it's good to go through the emotions or think it through what the difficulties were at that time. So I think, as you've rightly said, it's down to how you deal with it. In terms of the availability of mental health support, I think most places or most councils are expected to have some level of mental health support. There is some at the primary level. There is a lot of support at secondary level, and I think most of the time, maybe it's not, depending on which area you are in, it's not advertised well. But I think most, at least in my area here, sometimes when you go on the council websites, you can have availability to mental health services. I know in my particular area, unfortunately, sorry, I'm not in Manchester, they due to the COVID situation and acknowledgement of the COVID impact on mental health, there have been services, crisis services created specifically for that. And I would like to think that most areas or most councils are trying to put that across. Looking at mental health generally, yes, unfortunately, as you rightly said, and I think that our last discussion, it came up as well, the stigma, unfortunately, is still quite via, and it is still quite difficult for mental health to be put on the same parity of esteem or acceptance as physical health issues. And I think by going through having these opportunities to talk on these panels, then we're able to hopefully educate people and reduce the stigma over time. But I think, just top of my head, readily, most of the time, most GPs are aware of mental health services, both available in primary and secondary services. So if you're struggling to identify any mental health support, most GPs would be the best place to seek some advice or support. Thank you.
Sorry, can I just interrupt there? The main question that I was asking is for how are we going to get the information out there to our Black community that there is help and support available, because they may not have the access to go and look on council websites or the information that you've. I want to know how we're going to get it out there that they need support now. And they may not have the chance to go and look on websites, etc. So what are we going to do as a collective to get that information out? Thank you.
I would like to think one of what we are doing here is a way of passing on that information. I'm not aware of a specific website where we can go to. I think what I'm trying to say is different areas have different availabilities of services to them. So that I guess that is a challenge of specifically directing people to a specific location or specific place to find the support. But I think in terms of education, these are avenues that we try and educate people or have a discussion in general about mental health issues. And I think we just try and take opportunity of these invitations and discuss mental health issues. I think most Black communities do have churches or have some religious influence, and these might be avenues as well that can be used to talk about mental health services, and maybe those avenues are acceptable and comfortable avenues for people to feel free to talk about mental health services. So I think we just take the opportunity of wherever we are invited to or whatever is available. And if it's during demonstrations or wherever a crowd of Black and minority people are gathered, we could use that as avenues. So I'm sorry, I don't have any specific, I'm not sure if you want specific websites or something, but I don't know how to.
Okay, so thanks, Mami. Just to add on to what Mami has said, I think that you raised a point. Is it Sam or Sim?
Simone,
you raised a point about people feeling stigmatized as to whether they should seek help and wondering whether when they do seek help, how would they be perceived and how would people look at them. I think one thing I want to reinforce is that we should not feel that we would be looked down upon or we would be stigmatized when we present with our mental health issues. I agree. The truth of the matter is that there is still some stigmatization going on, which should not be the case. But let's not let that stop us. But I think the real problem is that when someone actually has mental health issues, they don't even have the motivation to go and seek help. Their mind is not functioning in the right way. So they might have all these resources we're talking about, but that get up and go to even go and seek help, to even go and find the right help might be the challenge they're facing. Then add on top of that, how they're feeling, what's someone going to think about me, and how am I going to be perceived, etc. So I think there are things that we can do at different levels. So one, in our own communities and our own Black, Caribbean, Asian, ethnic minority communities, we need to remove that stigma and be more supportive. So in families, in homes, in households, in communities, in churches, in groups, we need to actively try and remove that stigmatization, because sometimes even in churches or in communities or in groups, we ourselves, we victimize each other, which stops people looking for help. So we can do that. That's one thing. The second thing is, please speak to your GP. I know that we are time constrained. I know that is challenging, but I know that as a nation, because of the disparity between physical health resources and mental health resources, there is a national drive to improve mental health services. And unless we continue to come up with these things, we're not going to have the push factor enough to be able to push things in that direction. So please don't suffer in silence. Speak up, seek help. And when you come and you speak to us, we might not have all the solutions, but at least we can give you some information, we can refer you to the right services, we can treat what is treatable and manage what is manageable. And also, interestingly, with this COVID thing that is happening at the moment, with all the impact, the sort of heightened impact, the sort of worsened impact on mental health, there have erupted lots more support services available. So we've got groups. The other day I had 3 leaflets appear on my desk from 3 separate groups, all of whom are saying, if you're suffering with depression or anxiety or low mood or loneliness or isolation, call this number. 3 different groups in the same area. There are lots of little groups that are coming up because the council is pumping in some funding in that area, and people are organizing their own charities to try and support each other. Things like what CAHN is doing is a way of promoting this information in our Black ethnic minority groups. So groups like these can promote, how do we get information to our Black folks? How do we get information to our ethnic minority folks? So that's another way. And then the resources that are available might not specifically be targeted to ethnic minority groups. And that is a generic problem because it's just a general leaflet on maybe how to manage your mood or how to manage your anxiety or how to manage your PTSD. And so it wouldn't specifically be targeting a particular race. But I think as the more we talk about these, maybe we begin to realize that there might be the need for us to begin to put together our collective experiences and solutions that are peculiar to this group of people. And we can begin to think about developing leaflets or developing pamphlets or developing information hubs to be able to tackle this particular group of people whose cultural backgrounds and cultural influences would be affecting how they react to situations. And then finally, what I wanted to say, and probably not attacking secondary care in a way, but I think one of the frustrations that we've always faced is the waiting times that patients have when they need input. So at the primary care level, when we've managed patients and we've got to the stage where we need input from secondary care, or even we've referred them on for counseling or psychotherapy, as is best put, rather than counseling. Sometimes there's a very long wait. And if you've got someone who's really down, who's really depressed, who's low, and you're telling them they've got 4 weeks or 5 weeks to wait to talk to somebody, that alone can be really, really frustrating. So as GPs, what we try and do is sometimes we would say, look, you may not get an appointment for the next 4 or 5 weeks, but I'm happy to talk to you next week, for instance, or give me a phone call in 2 weeks' time, let me know. So there are all these things that are available, which tell you what, we are all equally frustrated, both the patients and the service providers. We're all equally frustrated because we want to help the patients want help, but there isn't enough resources to go around. So we're all in this together, and every life matters. Black lives matter, but we need to actively try and just make use of whatever resources we've got. And if you're struggling, just keep talking about it. There isn't enough resource there, but we can try and make use of what is available, and maybe begin to be creative and ingenious and come up with things that would target and solve our own problems. And that is what we need to move on from, just not identifying the problems, but how do we begin to translate this into solutions? Maybe one of us can take it upon ourselves, draft a leaflet, get some information around what specifically are the ways do we think that we can tackle these problems in this ethnic minority group. And before you realize it, it will be something useful that can be used by everybody. Thank you.
Thanks for that. Yeah, for those of you who may be interested, we have a mental health subgroup, and having conversations about what could we do, to get the word out there and spread that. So for if you are interested, just drop us an email at info@cahn.org.uk. And thanks for your time. In closing, going to pose this to our guest speakers. We're dealing with COVID. We've had in the headlines that it will be useful for every school to have a mental health practitioner. Now we have Black Lives Matter. I mean, I wonder, whether with all that is going on, I mean, well, what advice would you give us in relation to how we maintain a good mental health and well-being? So we'll start with you, Dr. Safo. I mean, what's your advice with all that is going on? What we see in the various protests, how should we maintain a good mental health?
Yes, thank you. I think if we just look at it generally, one, for me, I think is just for an individual to acknowledge if you are anxious about the situation, because it is anxiety provoking, and even within professionals who supposedly have the first-hand information and have an idea of what's going on, the anxiety is quite rife and it is going on. So the first thing is to acknowledge that the anxiety, you are anxious and anxiety is going on. That's one of the commonest presentations that is happening. And I think talking to relatives, talking to people over the phone, you realize that you are not alone in that aspect. And that is one very simple thing that can be done. But once again, if you realize that maybe it's getting a bit, whatever symptoms you're suffering, if it's your anxiety or depression, it's getting a bit overboard, then as Diane's been saying, GPs are readily available. They might not be doing a lot of face-to-face contacts, but calling your GP will be the first way to address these issues. I think what has been now is being picked up is that there is quite a lot of anxiety in children as well. And I think the first thing to do is, acknowledging your own anxiety, but talking to your children, talking to the young ones around you also helps relieve and settle the anxiety. Once again, as is being done, the best thing to do is also continue with the protection, the general advice about the preventive measures of the COVID, to continue practicing it, to reduce your own exposure to it. There is in the last few weeks, what's coming up in secondary mental health services, which is where I am, is that quite a lot of people who have severe mental illnesses, we're talking about severe depression, maybe extreme anxiety, schizophrenia, and all those, have been staying away because of the concerns about contracting COVID when going to hospitals, or feeling that they don't want to be a burden on the NHS. So we have been having people who have been unwell for quite some time, and therefore we see more severe cases than we would usually have. And also people who first-hand presentations are also quite on the high. So these are things that are existing. I think there is the help out there. Just reach out, speak to somebody. At the least, they will direct you to the correct people to try and support you.
Thanks. Before I bring, Dr. Asante in, I think Auntie Elaine has something to say. So over to you, Auntie Elaine.
Yes. Oh, thank you very much, Charles, for giving me this opportunity. I welcome the cultural diversity training at university, but I think it should start from much earlier. It should start from secondary schools. So these young people are equipped when they go out in the world, at least to have some semblance of cultural diversity awareness. Thank you.
I think I have young children in primary school and secondary school, and I think there is some degree of training, or they are trying to give the exposure, but as evident, it might not necessarily be, the content might be limited, or the degree that we would hope it is. So I'll leave that to.
Okay, before I bring Diana in, I think we've had a couple of questions, and it's really difficult, really delicate at the moment, because I mean, I worked with a colleague and we put out a press statement about the solidarity protest. Well, I think our current position as the Caribbean and African Health Net, the risk is still live. Our rate is just gone above 1 for the Northwest. So for anyone, who decides, who makes that independent decision to go out there and protest, we've seen from all the images, right from the US to Australia to London, that is very difficult to socially or physically distance. So if you make the decision to go out and join the solidarity protest, then please do, make sure that you're protecting yourself, but also think about those within your family and your personal circumstances. So if you are very bent on going, but you realize there are people within your household who are shielding or who are more vulnerable, then, it's important for you to think twice, because, we've had these protests, the protests will continue. And it's, for some of us, we have that personal view of what we need to do beyond the protest. Two other things to mention before Dr. Asante wraps up. We've set up a bereavement service, one that is led by Black people. So, the 5, counselors we have, who are all well experienced, they are fully culturally aware, and they are all Black people. So, you can either check from our website, or, just drop us a text if you know someone who has been bereaved as a result of COVID or pre-COVID. Because the situation, we all know culturally, when someone passes away, the whole community, we go into those people's homes, we cook for the one who is bereaved, we mourn together. But in the light of the lockdown, that is not happening. And we know that has increased isolation. So please, if you know someone who is mourning, who is grieving, who could do with, some support, then by all means, let us know. The other exciting thing that we have been lobbying and campaigning for, over the last 2 years, is a Black cultural awareness training program. And we just close to, it being finalized at the moment. So what it will replicate, for those of you who are aware of the training that, called Pride in Practice, which is about LGBT awareness training for primary care. Greater Manchester will be launching an equivalent where we are working with a system to develop a cultural awareness program, talking about the underlying health conditions that Black people have, the role of faith when they engaging with Black patients, all the herbal medication that people may be importing from, their home countries. So that's something we're really excited with. And, we will be working with some of the professionals you've been hearing about, because we know, there are many times that the equality and diversity stuff is a tick box, but we need to keep the pressure up. We need to we need to make it an ongoing training. So watch this space, and, let's keep talking. If you have any ideas, feel free to, approach us. Over to you, Dr. Asante, to wrap up.
Thank you. Just to touch on Auntie Elaine's question briefly. Auntie, I agree with you. I think that from a very early age, it needs to be ingrained in children, not just when they're old enough. And I think to buttress what Mami said, my kids, I've got kids in different sort of stages of primary school, and they do come home talking about these things. So I'm led to believe that they are teaching about this, probably not in the deepest of context, but for their level, I think they are introducing the topic, because they do come home and they say, oh, Mummy, you know, they're different people from different places, and we need to be nice to everybody and respectful, and we shouldn't judge people because of this and that, and we shouldn't treat them differently. So I think if my sort of 6 or 7-year-old is saying something like that, which I might have not said to her yet, then they're probably saying something. And I think it's always a good opportunity to then jump on and then reinforce the message, and also educate them as well. We should also be having that parental responsibility, community responsibility, to educating our children about these issues from a very early age. So that's just touching on that one. And then the original question about going back to school and the anxieties and how do we deal with things. I think we need to be cautious. We do know that there's very high likelihood that as we begin to return to some degree of normality, and from the 15th of June, I think a lot more is going to happen. Non-essential shops are opening and people are going back to work where possible, etc. We need to apply even greater caution. So we've all been cautious, but we need to be more cautious around social distancing, around wearing our masks where the social distancing is not possible. So now the government is making it mandatory on public transport, and you can be disallowed from embarking on public transport because they don't feel it's physically possible to 2-meter distance in a bus. I'm just imagining what's going to happen on the tubes in London when, you know, you've got someone literally breathing down your face when you're literally rubbing each other on the tubes. So we must apply every necessary precaution. It's difficult to let the children understand these things. And now that the reception children and year ones are going in, God help us. I mean, how do you tell a reception child to stay 2 meters away from the other? But kudos to our teachers. They're doing a really good job. They are trying their best. And we just need to keep reinforcing the message, washing your hands, you know, covering up, making sure that you are socially distanced where possible, whatever hygiene measures. And the more we talk about it, the more it becomes a part of life. And children pick things up very quickly. They're very clever. Their brains are very active. So they will get the message. And for all of us as well, we need to continue to be aware. In summary, what I would have to say for today is we do know that mental health is an ongoing issue. It's always been, but in this particular time, greater than ever before, it's become an even greater concern. The impact of the coronavirus has been massive on everybody, on individuals, on families, on nations, on economies across the world. You know, domestic violence has gone up, child maltreatment has gone up, cyberbullying has gone up. People are more isolated. People are financially sort of stressed. They're worried. Jobs are being lost, and so much uncertainty. Relationships are affected. So there is a lot going on out there. But I think the positive side of it, because we've got to find a positive in every situation, no matter how dark it is, there's always a silver lining somewhere. So maybe the positive side of it is that it's got us talking about it more. It's got us being more consciously engaging about it. And as I said, we've got all these charities being formed. We've got all these Zoom conferences happening. We've got all these networks trying to do one thing or another. Geared up. So let's keep talking about it. Let's keep acting on what we talk about. And let us consciously make a difference wherever we are. How little you make a difference, the collective nature of it will add together and it will make a difference. So that's probably all I've got to say. That there is help available. Try and seek help. Try and speak to your GP, try and self-refer to the local psychotherapy services available, try and speak to your spiritual leaders, try and speak to family members, and let's try and remove the stigma that is attached with it and try and, you know, improve it overall. Thank you.
Thanks, Dr. Asante. Yeah, so Professor Dawn Edge asked the question. I think, you know, for us at the Caribbean African Health Network, what we want to keep doing is lobbying and campaigning and trying to influence policy as well as practice. So, you know, if you have any ideas, if you have any experiences, you know, whether with one of the foundation trusts or the local CCGs, we promise to support you, in putting in a complaint. So, Dr. Asante talked about not sweeping things under the carpet. And I think that's really important. So, thanks everyone. And next Saturday, we're going to return back to women's health. We're going to have Dr. Eddie Osagi with us. He was on last week talking about, menstrual pains, fibroids, and, fertility. We did put to him next week to focus a bit more also on menopause and, managing that phase of life. So please spread the word. It's the same login ID, and we look forward to seeing you, next week. Between now and then, look after yourself, look after your mental well-being, and that of your family members. And, as has been said, seek help. Don't be afraid to seek help, because we all pay into the taxpayers, purse. And this week as well, CAHN, we've issued a statement about the Public Health England reports that was published. It wasn't what we were promised. So I was on Sky TV and Sky News and BBC News saying, the government has deceived us, another opportunity that deepens the lack of trust we have for government. So we've made our position clear to our mayor and the Greater Manchester Health and Social Care Partnership, and it's gaining some traction. So let's keep the pressure up. Let's hold our politicians and commissioners to account, and let's keep talking amongst ourselves, because together we're stronger. Have a wonderful weekend, and we will see you on Tuesday.
Thank you. Bye.